Everyone needs compassion, a love that's never failing. Let mercy fall on me. Everyone needs forgiveness, the kindness of the Savior, the hope of nations.
This is Chariot.
Hi, good morning, good afternoon, good evening, wherever you may find yourself. My name is Dr. Ebenezer Jari, and I'm very excited to be on this other segment of Chariot TV Action Time, specifically the Health Talk program that we have on Action Time. And it's been a while. I mean, who screen is so, but I have a lot going on. But that's not about me; it's about you. And about because if I say treating more in regards to your health, and also making sure say we are in check in terms of our spiritual health and one gets only pediano so for health. Internet in come bono if I yeah home. But ansana you better get into our conversation for today, lady kind of me percent me fasa and thank brother Obed for stepping in this segment I wore on Charity TV over the last few weeks on the motion idea in regards to like leadership. And so I want to use this opportunity to thank him and also welcome him aboard to be part of the Charity TV team and also be part of the Action Time segment. So thanks a lot to Brother Obed. And again, looking forward to having a wonderful conversation with you all this today, specifically on sexually transmitted infections. Now, who exactly do we have in our midst today? In Pakono EMS, I think the last time you saw someone that was not a brother, he gave us like a segment on our sickle cell, but today we do have a brother in our midst. Inyano, Yefreno, Dr. Dumako, intimidated about screen or so. Now, Mama, Dr. Dumako, no, my introduction of who exactly he is, what he does, and then we'll delve into our conversation for the day. And so, welcome, Dr. Dumako, to say.
Many Yamiadum, Tiasi, Nemamu Yabuko.
That's right.
Efreme Adomako, Mensa. Me Unia Ewo Nsawam Road Church of Christ. Yamiadum Ti Suya Sabionsa Nujuma Kakra. And I trained as an obstetrician gynecologist in Ghana. And Yamiadum last year, and Mitimide Adisuabe Nina Berry. I'm a fully practicing obstetrician gynecologist in one of the hospitals in Accra. And he said, I'm a kind Messiah. I'm managing a mobile program. So, they be doing como afa apomodin.
Great. It's in my Kwaba to the program. And if viewers know, Mr. said, we might won't get intimidated about who we are and what we do. So, so no question you can always feel free to reach out to any of us, and we'll be more than happy to help. And to know, in terms of your conversation, in there, specifically STIs, which is sexually transmitted infections. And to know, Dr. Dumako, what exactly is sexually transmitted infections? And we are saying like like what I didn't know was a concern to us.
Okay. Cancer sexually transmitted infections are kind of so any form of infection that is transmitted through the sexual act, it's termed as a sexually transmitted infection. So, I mean, there are so many forms of sexual gratification involving the genitalia. And so any kind of infection that can be transmitted through these sexual acts are grouped as sexually transmitted infections. And these are a large group of infections that account for a large burden of health burden on the world and the world over, especially among young people. The efforts and a lot of commitment and a lot of funding goes into trying to prevent and reduce the spread of these conditions, because I think we'll share the causes of morbidity and mortality. It runs about a second to cardiovascular event and other. So it's a very important condition that we also need to look at. Now, as a group, as a society, where sex forms part of our daily activities, we have to be concerned about sexually transmitted infections because we are involved in it. And so all the pleasures, the good and the bad things associated with it should be known so that we can practice it in the right way to benefit all of us. Inti kakra maka ne se yeka se sexually transmitted infection nkitahudi a eda nipa ntem efa sex ho se oba ne bema ehia ana bema ne bema ehia enam saa nkitahudi no etimi de yare ba na saa yare na ede ba no ya hudo bebre ebetimi aye sometimes bacteria, viruses, and other things. Now, so bebre ba a hard dream, itimi kun nipa bebre. Unfortunately, itimi affected a mabuno ha omwa hode betimi aboa ma omaya koso and I affect you. Nti ehun hia se ye besusu ho ana ye bedi hu komone hu ene amabone a ewom ene ne amapapa ewom na kwan betimi afaso esu ade afrim.
Yeah, but as I said, while summarizing Niamani in terms of like Kofwa, it to me affected or more, and Niamai was here, yeah, maybe to me, they a boy and hobby. And to know, so your question on this question and say, abstinence is important and whatnot. But we live in a world that, as youth, people like to experiment things, right? And we've been taught in our Christian life, say, sex is what is for the married couple. But here's a case where people would like to experiment. So in events where they go and experiment, not say omu contract any sexual transmitted infection and as a disease, what are we going to do in order to make sure say stigmatize it or more? Because obviously yare no or more, and say stigmatize it or more, not say yare no or more, not say omu do ko more. Is the church at fault, or is this the individual that is like, because of lack of knowledge, isn't able to get the cure that they need?
Well, that's a very good question. And to answer this question, a scenario I will be creating, or say the church is I mean, sometimes we commonly say this, church, a gathering of saints. Yes, I mean, in the context of the spiritual context, in the Bible, biblical concept, yes. Yedi enwama asubo na afre nyina no Yesu ate ho ne moja na ate ho nti we are saints in quote. But practically speaking, I would also say it's a hospital for sinners. Nti we should bear this in mind, say yekuhyiamu a nipa kwaku a nipa di ade bia fa nipa ho no ebi etimi esi ewa asorefo nim enu nti no yes Bible aka say abstinence any said the nyame hyehyɛ a ɔde hyehyɛ nipa ayɔnkofa da nipa ntam no na nka ye ne feso say oba any obekra ne ho be ma bekra ne ho na drum ra ni fie so a ɛsɛ omo ware a nka oba ne bema akusia amamre kwan so na omaka ho abom na saade no esi wie a oba ne bema omaka ho abom ba ko bema ba ko no ombetena na omo na nyame amakwan e wo ne hyehyɛ mu se omutimi di sangita ode no wo hwɛ 1 Corinthians chapter 7 and if chapter 6 latter part of chapter 6 sa adanside wo say ye ka ma ne bema nkita hodi a na sex a anka ye nhyehyɛ ya nyame de ato ama oba ne bema nanso ye ba soro no nkrofo bebre wote be mu ansa na omo ba mu nti obi wo kra no a contract yare ansa na oba de toso yen ya ye team no yes o mu say expectation is ye ginyame asem a ye tie ye de atu ye honfo a ye nyina ye be ebobra kronkron nanso etimi fom senka ofom eni ho a nka bible no emfa say meda ho say ye fom a sabi o ye nsre bonifache nti because of sa ofom ne sa niema we nyina ti o nti no say ye hu niema sabi o ye betimi niema enhyehyɛ fa na ho ne yare fa na ho because obi betima afom se onware ye na sabi obekwa akobo adwaman ana se obefa ne be ne ikunu ana ne rechi ana se na woti bia mu dada afi na wabesakra yare ne de sabi o sakra nyame de obone achewa sesa ba yare ne de ewo ho nti sa niema nyina nti no se yenya ntiase wo apomuden ho kyese da sa yare ho na etu anamo eni na ema important say asore no ye beti sa na ema yase na yasiesie ho se de be ya ye be nkwan ye be fa so aboye ho ban free ho. We are not encouraging infidelity, we are not encouraging premarital immorality, but the reality is that as a group of people these conditions exist amongst us. We need to understand the scope of the diseases and how it is transmitted and how we can prevent it.
I like how you summarize it. Say, I would say like basically it's basically going about educating ourselves. So taking that point of educating ourselves, I know like the church is also an institution to educate the church members. And obviously, there would be a teaching, right? The doctrine of the church that is already implemented. And also, there would be the human relation part of it. So, here's a case where within some churches, there is a policy that you need to complete certain requirements, such as like your health requirement before you get married to a partner. What education or person will use on this platform to educate your counselors, no more churches know? When it comes to these things, because again, for someone to disclose their health records to you when it comes to sexually transmitted infection, it's a sensitive matter. So because you don't want to be stigmatized, what education would you give to some person or a counselor listening to this recording today or whenever, as in, again, I was saying, so be said while contracted disease no be no about a marriage process with me, how do I educate them? If that question is clear.
Okay. In fact, sexually transmitted infections, because of the nature of the disease. I mean, before recent times now, there were no effective medicines to treat these infections, and the kind of impact and cover a lot of stigma, and of course the mode of transmission, say sex, adwene da nipa bebre society ni say obi kobo akohwisem a na obi nya sa yare enu nti ama a lot of stigma na stigma say obi a ye hwe nipa no kwan bi so ayonkofa anase odo anka ese da di che sa nipa no na ye twen even among Christians. Enti society ehun say saa de no emma nkrofo open up so mo yare ni bia omo na ne di ma ehun. One of the effective means of prevention of these infections is disclosure, knowing someone's status and disclosing to appropriate parties. Because nipa ni nim so obia emma said you see born ho ban no sonko. Onim said the obefa so ya kire kwan obefa so ene oni nipa ngita hudi aye even among the partners. Enti asori a yenso yebotaye ne ba ko nso ni say yebeboa na sabi owiase ayare ne ohawe da nipa so yenso yebeboa ama sa ne manaba from. We have a public health role to play as a church. It is very important for the church to adopt some of these strategies that will help limit the spread or prevent the spread of the infections and not escalate it. One way I said the okay counselors say be so koye monkoye test oba ne be ma young couple mpeso mo kom boom eze monkoye test na ma warning edbi minti ye ma warning say test no mokoye a doctor na ntro obetro no dey abre the counselor and more yekoye mo test no munni hu hwe nti the first person to actually break to you say oh yare A and B maybe the counselors, one or more counselors. Counselors near training to some extent. Of course, any will be ever find a counselor so that they will respect what we call confidentiality in the counseling process. No say ubi asemuno any kwan say a babonti. Moyasa then you feel as a counseling group. But with that, still the current practice is problematic because I think say ubi health records and the personal records and the hospital facility and our laboratory facility ISR test hold that as a confidentiality as a principle guarded by law and ethics. So maintaining the confidentiality of the person health status. And it is only by the person's consent and it can be disclosed. Inti baby amekobia what I propose and what is very sound practice say moko couple neko hospital or no moko test na the doctor or the practitioner or a laboratory has to disclose individually to each of the parties. Then agree with them, say, these are the people who sent you 20. I'm going to disclose it. Do you allow that? If the person gives a consent, fair enough. If not, then the patient is not obliged to disclose the records to the counseling unit. Of course, the counseling unit also has that right to decide that, well, because we don't know about ABC, we cannot advise you to move along with your union or blessing of the union or not. But that's another discussion too. So that is the proper, the parties should be aware and they should have a consent to disclosure. Even in fact, we have some laws in some of these STIs that guards the practice of STI, especially HIV, among couples. That yes, the partner is obliged to disclose to the party, and failure to disclose, is subject to some kind of punishment. But even that, the health personnel as a your role is to impress upon the party to make the disclosure. The affected party to make the disclosure. So it's a very dicey situation, and we have to really change the traditional practice where prospective couples are forced to send their medical records without their knowledge. I think that's what I would say about it, because how we handle these issues can be a very important tool to help spread the disease or prevent the spread. Obi owa that na yi ekoda abontin pe ana obi kohwe no some way bi e wa sore pe osusu se na sem no obi ate eno kra waja asore no, and then the behavior afterwards. Okay, if the church is even treating me like this, then how much money I feel there obe starting behavior be a betimi ama adena spread rather than the other way around. By a chom maintaining confidentiality, I mean, even when we're afraid we discordant just say bako a positive, bako a negative. It's just counseling. There's a way we go about it. Say that, well, if they even decide not to go along, there's a way we go about it so that the other affected party, will not be, negatively affected. There are couples that are discordant. They say negative, but they will decide to go ahead, especially when there are measures in place, effective measures in place to protect the vulnerable party.
Yeah, that's excellent. And I was going to ask you, and I think you kind of like alluded to a little bit as to STIs. Kind of STIs that you've kind of like given like an overview as like this is what it is, right? How do you say like basically sexual intercourse that leads to the infection, right? So specifically, what are some examples of STIs that we should be mindful of or aware of? Because if you're going to go through this marriage counseling thing, it's expected of you to complete some labs. So then I may make a hospital for the sake of the audience.
Yeah, so your case STIs said the edical canon. And mind you, see, people we think so sexually excuse my language, no organ, no sex organ, the penis entering the vagina, and non a means of transmitting STI. No. In fact, me come out talk, baby. I mean, let me digress a bit. Now, I was very alarmed because then a question was asked as to say, these days, the young girls think, so, Sebu or person worry as a virgin. And the virginity is determined just by the structure of the female genitalia. And what they do is other things. And I mean, strangely, the person even felt those other things are actually not sinful. And so, Pino Ena, between a man and a woman, oral sex, another means of self-gratification are. And that is dangerous. It's not only penile vagina that can lead to sexually transmitted infections. It could be mouth to mouth, so kissing. It could be mouth to the genitalia. It could be genitalia to the anal cavity. In fact, the rectal transmission through the rectal mucosa is about twice or 3 times as higher as transmission between the male genitalia, the penis, and the vagina. So the rectum is a very vulnerable means of transmission, very vulnerable structure. So having said that, yes, we have viral infections. The virus also they cannot survive on their own. They need to be in some other organism, living organism, cells, and the viral infections are highly common. In fact, they are more common than all the other sexually transmitted infections. Now, popular amongst them, HIV, and one thing people have to realize about these viral infections is that they tend not to be curable. Say ebetena oni padua no mu a eduro bia ni wa ebeku emuawa ni nyina fri oni padua no. So that is the danger about viruses. So HIV is one of them. Herpes is one of them. Herpes and said that dream cause so papa, but my example sometimes, and it's very common, what looks like blisters. I say and some be a go nsuo ahyehyɛ sɛbio bɛrima na ɔbɛrima no ɔbaa no nso awase hɔ ne nsuo na ya na ɛyɛ paa nti etimi papa na ekuru ɛno na yɛfrɛ no herpes yɛ ɔmo mienu ebi timi yɛ ano ha mame nka twi we de jare bi a wonte ase in Ashanti language yɛfrɛ no nwa hono so yes cold sores in tree in English. Sorry. Yes. Okay. So etimi no ho. Na eno nso ye one of the herpes infections. Nti herpes ewo ho. Ye wo other viral infections a bit is hepatitis. And hepatitis, it's a very dangerous. It can cause liver cancer. It can cause liver failure and other hepatitis, but common sexually transmitted implicated ones, hepatitis C and B. Then you have HPV infection. HPV is a human papilloma virus. Common conditions cause genital warts. Warts and also their flesh and also when someone can see bitimi bubo and not the insubi and but enye yanso but etimi yekese pa in fact semre bam na ye share video about it etimi some of them are really really horrible to and oba or what no or kwa o ya etimi kofa problem bebreba ebi timi transmit man ba no na what ni bi akoya akola ni truth. It can also cause a lot of respiratory problems and can kill the babies. Another problem with HPV, human papilloma virus, cervical cancer. Into the cancers are sebio ya sitting muse de si boy brand and environmental factors, be genetic factors, but some cancers are caused by infections. One of them is human papilloma virus. Another one is hepatitis and cancer cause liver. So human papilloma virus, who are infected with some of them in some years to come, as time goes on, they undergo changes in the cells and can cause cancer. The other thing, viral infections are I think I've mentioned the common ones that are. Then we have the bacteria ones, which are very common, chlamydia and gonorrhea. Then we have protozoa infection, not the omonye viruses, omonye bacteria, into trichomoniasis. Also vaginal discharge. Now, the danger about these bacteria infections, especially chlamydia and gonorrhea, and they say sometimes in fact 50% of munya, they don't even know they have an infection because you may not have symptoms, especially chlamydia, but they are implicated in more than 50% of pelvic damage to the genital tract. Also infertility. It's also your friend is saying chronic pelvic pain. And it also ectopics. In fact, obanya ectopia, the tube no asay kakra. And I talk about chlamydia and any effects. Say it may destroy fallopian tube. In fact, the literature on infertility, the world over, most the Western world, the commonest cause of infertility entire hormonal problems, hormones and other things. In Africa, it's tuber problems, the fallopian tube problem, and it's because of the effect of these chlamydia infections that destroy tubes. Yes, so that's basically a summary about sexually transmitted infections that we have, common sexually transmitted infections around.
Great. And yeah, that's it for that response. So the question I'm basically be saying, I know, so like, what are the kind of talking about the stigma revolving STIs, right? People don't want to come out to talk about, say, more diseases and whatnot, right? And you've talked about the counseling part. And what's I saying, like, diseases are not saying infection side, it results into that group of STIs. So the question I'm basically be saying is, say, how do we exhibit some traits of compassion and support for people that have contracted this infection? And in your view, how do you think, say, Jesus Christ would have responded to folks that have contracted STIs within our community?
Well, so first of all, Jesus' example, we are Christians, and Mark chapter 16, verse 16, where the commission was given, the disciples were told to go and baptize, preach, baptize, and teach people to observe all the things that Jesus had taught the disciples. And one of the greatest teachings that we see from Christ, the love he exhibited towards sinners. In fact, he dined with people that were considered as prostitutes, as tax collectors, and so on and so on. To look at where Jesus healed that the blind man, where the disciples were asking, what wrong the person committed? And the response was that the person is not because he has committed any crime or his parents have committed any crime. It's just for the glory of God to be manifested. So we need to show compassion. 2, even those who have been caught in a crime, Jesus forgave them. Jesus was asked to place a judgment on a woman who was caught red-handed in fornication. And he forgave her. So we need to understand, like I said initially, that the church is like a hospital for all of us, for sinners. So we all go there for healing. And the healing processes takes time. In a hospital, people come with acute complications. People come with malaria. Some people are walking, they come. Everybody has a problem, but some will be given a drug. Some will just be talked to and they are okay. Some will be admitted. Some will be placed in the intensive care unit. At the end of the day, almost everybody will probably walk home, but it takes time for some. Some will take a few days. And that is the perspective we need to have as Christians. And so we need to, first of all, let people know that we understand the situation we are in, the difficulty we have, or the challenges we have as Christians to be in the world and to have all these worldly stuff around us and to dealing with sin. We need to understand that. Once everybody knows that, we all understand the kind of pressure and the challenges that we face, people will be ready to open up to us. We need to also look at how we treat people who confess at church. People commit issues and then they open up to us. We need to embrace such brothers. We don't need to, in fact, in other places, person confesses, then they ask you to sit somewhere at the outskirts of the church and for a number of time. All these things. So all the members who go to that congregation knows that these kind of people who sit here are people I mean, this is not the Christ way of dealing with the people. One thing we have to also recognize, in fact, there are people who contract these infections out of no fault of theirs. In fact, people are born with it because there's what we call vertical transmission. So people whose parents had the infection transmitted it to them. Some health workers have, unfortunately been transmitted through their work. Some people were raped. And so we cannot identify how person A or B contracted the disease. And that is why we must be empathetic to everybody and show comfort and compassion. One of the things is what we are doing by giving counseling. Those who don't have it, how do you protect yourself from getting it? Those who have it, how do you, what are the measures you can take to live a healthy life, even when you have it, so that the disease or the infection does not have control over your life? And then for all of us, even going beyond the Christendom or the congregation to the public health role that we have to play to ensure that the spread is curtailed or slowed down. So, number one, we need to show people that Christ loves everybody, and so we also love everybody. We need to understand people that we understand the challenges they face, and that's whether it's their fault or not, because Christ has embraced them, we have also embraced them. We need to share in their burden, i.e., sometimes some people, even the care, the medicines to take care of these diseases, they cannot afford. So we need to be there for them as a church. And some of the ways, I know some congregations have opened up hospitals. We can support people with funding. We can even support government projects that are ongoing with some funding, or even personnel, by education and other things. So I think these are some of the ways we can help to show support and compassion to our brethren who have the infection.
Yeah, thanks for that great overview, and a good summary of like how we should show compassion to our brothers that might have contracted the disease. So my final word for you is, what are some key takeaway message? What are your thoughts on like this whole conversation we've had for someone that's like listening to us that may have contracted the infection or has not contracted the infection? What are some things that they should like take away as a lesson from this session that we have today?
Right. So the takeaway message is that sexually transmitted infections are real. They do not respect color, race, spirituality, or anything. If you break the rules, i.e., the only 100% preventive measure is abstinence. That's the only 100% assurance. And so when the Bible tells us to be chaste, preserve our bodies for our married couples, it is not for fun, it's for our own protection. And so, number one, I will entreat all young Christians to really, research has shown, a couple of research that are available has shown that the risk of transmission, the risk of transmission is really very low in religious people who, number one, who attend religious meetings frequently and who tend to be more affiliated to or who tend to follow their religious guidelines religiously. So commitment to Christ and his word is a protective measure. And so we need to, as young Christians, make sure that we follow and we listen to what the Bible is telling us. That's number one. Number two, beyond abstinence, there are other measures, and currently one of the most effective, not most effective measures is contraception, to use condoms, barrier methods. And I'm sure that some Christians sitting at home watching us will be raising eyebrows. Yes, but we, as I said, is part of us. So we need to understand that it's part of the challenges that we face as a Christian. And so we make sure we take measures to protect ourselves from it. So our young people should be taught about the effective role that condoms play in ensuring that you can prevent these infections or limiting the transmission of these infections. So we need to encourage sexual health conversations, sexual health educations, and especially to the young one. In fact, about 50% of people between 15 to 25, okay, 50% have this infection, who are sexually active anyway, have sexually transmitted infection without knowing. And you look at 15 to 25, these are young people in secondary schools, in universities. So we need to really hammer on sexual health education to these people. And then those who have it, I mean, there are treatments available, so they should get to health. We have adolescent health clinics, we have STI clinics in most hospitals. But even that, in any general hospital, especially if you cannot report to a specialist clinic with these complaints, you want to screen for STIs, you have had some exposure, you want to screen, they will screen you and give you counseling on effective ways of protecting yourselves. Okay, so that's what I will say, that we have to acknowledge the fact that it's part of us. It's a disease. As humans, these afflictions are part of it. We have to accept the reality that it can affect anybody. It doesn't, the mistake we also make, this is a songs leader in church, but is a nice looking guy. He cannot have any sexually transmitted infection, but it's not written on anybody's face. It doesn't matter whether the person is handsome or not, person is lean or well-fed, everybody can be. So any unprotected sexual act is a risk. And therefore, we need to follow the guidelines. So one, if you can abstain, fantastic. Follow Christian principles, wait till you're due for marriage, go through the medical and counseling instituted measures to before you can engage in sex. If you do that, that offers some protection. Then also, like I said, there are condoms and other sexually protective mechanisms that you can follow. And if you have that, I mean, you cannot control yourself and abstain. You have to approach health workers to get these measures so that you can follow them. And then those who have it, like I said, they should seek help.
Thank you so much, Dr. Adumaku. I like how you summarize it, and I guess the key message here is that there is no fear. If you ask for help, you would get the help and be able to overcome the disease itself. And so there's a word of advice for our youth. Again, there is no shame. We're here as a resource to help you each and every time. And feel free to share this message with friends that you know, family and loved ones. Dr. Adumaku, I'm looking forward to our next segment, and I know that it'll be far better and bigger from here on. Thanks again, and again for our viewers, thanks so much for tuning in. Wish you a wonderful day. Bye-bye.
Thank you too. Thank you for having me. Bye.